welcome into the Wednesday edition of Helping Seniors of Brevard. Kind of some music of your life, Kerry Fink, to get things started.
I'm all for that, John Harper. It's all good music. We're having a good time here. It's going to be a great radio show today. I'm Kerry Fink. Thank you, John Harper. On behalf of Joe Steckler, our president and founder, Kim Bernard, our education specialist, the entire Helping Seniors team, so happy to have you with us for the Helping Seniors radio show. Happens every 12 noon on Wednesdays right here on 90.3 FM WEJF. We're broadcasting right here out of Palm Bay, Florida. And in the studio with us today, we have some very distinguished guests, friends of the Helping Seniors radio program, and really friends of Helping Seniors just overall, is Jennifer Helin with Seniors Helping Seniors of Brevard. How are you today, Jennifer?
I am wonderful, Kerry. How are you?
It is all good. You know, spring is sprung. It's beautiful
Gorgeous
weather.
Day.
I guess as long as we stay away from the pollen. But outside of that, it's just lovely out there, isn't it?
It's beautiful.
Yeah, it's good. And also in the studio with us is the world famous, he says, as he's laughing, expert on holistic health, Dr. Kevin Kilday. How are you, sir?
I'm very good. Thank you. Thank you for having me.
Yeah.
It's a great, beautiful day out there, and feel good, and that's all that matters.
Yeah, no, it's really nice. You know, a year ago, they were just telling us to put on the masks and prepare for 15 days to slow the spread. And here we are a year later, and everybody, now by show of hands, who's had their vaccination so far? So that is 3 out of 5 of us today. Dr. Kevin, you're not yet, huh?
No, I'm waiting for the one shot. From J&J.
Okay.
Johnson & Johnson.
But you, John Harper, you've had no ill effects. I know Joe said no.
None whatsoever. It was something that worked out very well as far as getting the first shot and then following up on that 2 weeks later with the second one, and it was no big deal.
Yeah, and I know Joe reported no problems. Jim, you all went well for you?
Yeah, no problem at all. I got a little red spot on my right arm, and that was about it. And other than that, I might have been tired. It's kind of hard because I'm always tired. I'm old.
Well, there's always challenges. And Jennifer,
the red spot on his arm was from his girlfriend punching him.
Okay, got it.
So I did have
true.
a little bit of a reaction. My arm did swell quite a bit
Did it?
on the first dose, but luckily that didn't happen on the second dose. I know both my parents and my sister's compromised immunity. They did not have any problems whatsoever. So thank goodness. What I'm hearing from clients and my caregivers, we did have a few that had, after the second shot, had 24 hours of flu-like symptoms, maybe a little nausea, a low-grade fever. But within 24 hours, it was gone. So they said it was really nothing that they would do it over again.
Oh, good.
Nothing that they were really worried about.
Well, I know that Kim Bernard and I were just recording a Helping Seniors update that she was talking about that they've now announced that the rule is now people 50 and over are eligible. I guess it's still a challenge. You have to get the appointment. In fact, Jennifer, your office has been helping people get appointments.
We have. So there has been more facilities doing it now. You can register through Publix, but you can also now register through Health First, Sam's Club, Walmart, Winn-Dixie. So there are multiple places now. In the beginning, it was just the Department of Health and Publix. So it's gotten a little bit better because there are more places to try. And I do suggest Monday, Wednesday, Friday, 7 a.m. getting on Publix. On Wednesdays, typically they do the Johnson & Johnson, but I've heard that they don't have the supply right now. So unfortunately, I don't think they're doing the Johnson & Johnson right now. But
Where did you get your shot?
I got mine through the Department of Health.
Yeah, I did too.
Very well organized, very well done.
That's what I thought.
And I've heard the same about Publix and Walmart, that very well organized, very well done. I've had nothing but compliments on all of the organizations that are giving the vaccine.
Yeah, well, Chris Morse, who, as you know, is Helping Seniors Travel Club, he said the same thing. He had high remarks for, he'd gone over to the, I guess the health department, gotten his shot there and said, it was no problem. So I guess the everybody here recommends to do it. And I guess if somebody has a question about how to set that up, or maybe they're not comfortable being persistent, they could. You guys are still doing that for helping folks.
Yes,
right?
and we have no one on our list right now. Anyone that has been on our list, we've been able to get vaccine
Wow.
appointments for them. So if anyone does want a little help, give my office a call, and we can either, walk you through getting on a list either with Health First or Department of Health, or, if you don't mind giving us a little information, we'll go on Publix. We call it playing COVID casino because you don't know if you're going to get through or not, but we hope for appointments and no whammies.
So this is Jennifer Helin of Seniors Helping Seniors, and to call your office, what's the number we use?
So give us a call at 321-722-2999. And like I said, we would be more than happy to, if you've had a problem, a lot of our seniors have problems with technology. They're not great at the computer, or maybe they're just working with a phone. So give us a call. We'd be more than happy to help. 321-722-2999.
Yeah, because I remember when they first started doing the vaccinations, and I remember John Harper and I were talking about this on the radio, that you had to start at like some unbelievable hour of the morning to try to be able to get the appointment, and so many people just got shot down like that first day. But I guess now it's getting
I started at 5 a.m.
Wow.
Yeah.
But it's now getting easier because the supply is better, and so we're working. And that's where we started the show, folks. We were saying it's springtime. People are feeling better about things. I know that we were out at a car show with the Helping Seniors car raffle. I guess it was a couple of weeks ago, and I remember thinking it was the show for the Satellite Beach Lions Club, and I remember thinking, wow, there are a lot of people out here. You remember that, Jennifer, because it was like the first outing, and everybody was just happy to be out.
I think everybody's excited to be out and about. A lot of people have had both vaccines, and they can't wait to rejoin society. We've been cooped up for a whole year, and people are ready.
Yeah, I know this has been an ongoing topic also that we've all had along the way, that even though it became fairly clear early on that we could keep seniors safe medically if we did the right things about the isolation and the hand washing and the 6 feet and all those different, the masks and everything like that. But I remember we were also having the conversation about what kind of a cost it is for people, in terms of, for lack of a better term, mental health, because we're all stuck cooped up.
Yes, the mental health effects overall from this pandemic have been very bad. All the statistics show that the drug abuse overall, alcohol abuse overall is up, depression is up, anxiety is up. I don't want to be the Grim Reaper, but it's just because of people, the unsure of the future, and being isolated, and the fear and self of COVID, and and all the above, and the same thing. We had an opioid epidemic before this whole thing started, and it has gotten worse. As a result of the pandemic, also, so these things, they are being addressed by the mental health industry. That there's a lot of counseling available online, and there's been a lot of increases in. Cause I get offers all the time to join an organization or something, and to help people, via over the phone or whatever. So there are a lot of resources out there. You just have to look for them.
Yeah, and that is one of the things. You wrote an article, actually you brought a copy in, called The Spiritual Connection During the Pandemic. And I know, Dr. Kevin, you've actually spent a lot of the past year helping us with information that I guess helps people get through this whole COVID crisis. And you've talked about, you have an article, it's actually in the March edition of the Senior Scene magazine. It's in the what we call the Helping Seniors newsletter section, which is those yellow pages that we publish every month, center section, so you can easily identify and pull them out. And the article that you did this month was called Supplements Proven to Reduce COVID Severity. So you've really studied a lot of this from the holistic side. But in particular, I thought it was interesting what you had written about the spiritual connection, because now that we actually have a chance to get out a little bit, I think that's going to help a lot, isn't it?
Yes. The overall, the COVID, new diagnosed cases are coming down. The COVID death rates are coming down. So everything is looking very, very positive. But everybody still has to, do preventive, measures, and I recommend, of course, taking supplements to keep the immune system built up, and that's why that was actually a rewrite of a COVID article I did in the early days. This one in the March issue, because I found just from study, from research and looking at, research papers and things like that, those are the supplements that seem to be the most effective, and is backed by science, and and it includes a good high quality multivitamin. To try to stay away from the real inexpensive ones, because they have poor what they call bioavailability. I mean, they don't absorb very well. They just go right through you. So it's good to get a high quality the type of multivitamin, and then add some extra vitamin C, and add some extra zinc, and one of the most important ones is actually a doctor out there that I seen recently, that he really believes that everybody in this country should be taking vitamin D supplements.
Wow.
Because
I will agree with that, and that's one of the things, Dr. Visa has done a lot of talks about medications and vitamin levels, and I had gone to a talk, and she really recommended having your levels checked.
Right.
And they said, starting at 50. So when I turned 50, I had my doctor check, and she kind of looked at me funny, like, why are you checking your vitamin levels already now? You're too young for that. And I said, no, I really would like to do a baseline to see where I am. And sure enough, I was low in D.
Well, specifically vitamin D, there is a very good, medical test out for to see what your level is, and that is a good idea. It should really become, and some doctors are doing it without asking, it should really become a standard part of your annual blood work.
I really think so, and especially as we get older, we're not metabolizing things correctly. So, D and other vitamins as well.
And the and vitamin D's, they're finding through autopsies, and then through the testing of people who have COVID, and even in cancer, because one of my specialties is also cancer. A majority of the people who have these diseases, they test them and they find out that they're severely deficient in vitamin D, especially.
And so I've heard a number of people tell me, oh, well, I live in Florida. I get plenty of sunshine. I don't need extra D. And that's not true, is it?
I do hear that all the time. And yes, from all the sunshine and stuff, you can get a fair, a good amount of vitamin D, like, I've heard as much as like 10,000 international units just by staying out in the sun for 15 or 20 minutes, a day, but it's just unknown, like, how long it stays in the body, and how, and there's some variables there of how strong the sun is at that particular time, or what time of day it is.
Well, I've also got friends and my own son. We were talking about my son before we started the radio show this morning. We were talking about, Dr. Kilday was talking about some allergy tests, and my youngest has a few allergies, but food allergies, but he also did as a little one test low in D. So he has always taken a supplement, and he is outside all the time. He's a surfer, very active, football, lacrosse, but for whatever reason, he does need that vitamin D. So it's not necessarily even an age thing or how much you are out in the sun.
If you take this supplement, you know that you're consistently, maintaining a level, okay? And that level is improving your immune system, therefore protecting yourself against illnesses like COVID and other diseases.
So yes, and we're talking with Dr. Kevin Kilday of the Holistic Health Center, who's one of our guests today on the Helping Seniors radio show. Dr. Kevin, I know you basically specialize in 3 different areas. One is, you already mentioned about the cancer protocols that you work with, but also you are also in the addiction recovery. So people that may have gotten too dependent on a substance or things like that, you walk them through that as well. And then you're also kind of an expert on the pain management side using holistic approach. But how do people get in touch with you if they want to maybe learn more or get some more information about what we're talking about?
Yes, well, my website is holistichealthcenter.us. That's holistichealthcenter.us. And my phone number is 321-549-0711.
And I'm going to get you to say the phone number again, but I want to remind everybody, since we're on radio, holistic is HOLISTIC, right?
Exactly, yes. Yeah, there are some people out there for some reason put the W in front of it because it is taken from the word whole, as a whole person,
right?
Mind, body, and spirit. So some people do think that, yes, but I think maybe way back in the day it was spelled like that, but today it's spelled with an H.
So holistichealthcenter.us, and your phone number again?
Yes, 321-549-0711.
So
and I always answer the phone. If not, you'll get my voicemail, and I will try my best to call you back by the end of the business day.
No, that's good. So one of the things I wanted us to talk about before we get to mid-show break is a little bit about we have some plans for you for Saturday. He said presumptuously. It's actually a lot of fun. Now, I'm going to explain to you, this has to do with the Helping Seniors car raffle. We've just been talking about the need for socialization and people getting out, and the weather's good, and we've either had our shots or we have become very well schooled about wearing our masks, safe social distancing, and doing this the right way. So we're actually going to be out, of all places, at the American Muscle Car Museum on Saturday. And that's going to be a fun day. It is the Cape Canaveral Antique Auto Club Association that is putting on a huge, huge car show. So they were telling me they're going to have over 500 cars out there, Jennifer.
Wow.
That's amazing.
500, and that's just outside. That doesn't count Mark's cars on the inside of the museum. And they're actually, listen to this, they're actually going to open up the museum. So this is the first time in 14 months that somebody from, us outsiders can actually go inside the museum. Now, I have had a couple of people say, is this the Helping Seniors Make Good date? Because you guys said, hey, we couldn't have the full gathering in October of last year for the grand drawing. We did give away the car. Troy Darling of Indy Atlantic is tooling around, probably even as he's maybe listening to us on the radio, even now, in his beautiful new 2020 Chevrolet Camaro convertible. But we didn't get to invite people into the museum last year because of that. And so we are scheduling a make good date for, or actually dates for the Helping Seniors ticket holders who were involved in the 2020 raffle. This is not one of those dates, and here's why. It's just because this is the first time they're opening. They're already expecting like 1,500 to 2,000 people out there. So it would be too much to have the 2,000, 2,500 people we bring in plus that, and they're just getting reopened. But we will expect to announce a date for our Make Good for 2020, actually in the next coming weeks. So, but this is a chance for you to kind of preview what's been going on there over the past year, because again, it's the first time they've opened it up in 14 months. So I think the show goes from 10 a.m. to 3 p.m., and we will be out there helping seniors. You guys are actually, Kevin, are you going to be able?
Yes, I'm going to stop by early in the day. I'll be there for a few hours.
Good. And Jennifer?
And I will be there as well.
Yeah,
Yes.
We're actually laughing because it sounds like Ashley and Charisse from Hibiscus are actually going to be there too. And if you remember, folks, from last year, that was our team. That was our Team Chevy group that was all rooting for the Camaro. And then Jennifer, you and Ricky from your Seniors Helping Seniors office, you guys were Team Dodge, and I think we may even be close to having a reunion out there on Saturday.
Yes, I'm trying to con Ricky into coming over. She, I believe, will be able to make it, so we may have to talk a little Chevy versus Dodge.
Yeah, it was so funny at the last event. Jennifer, to try to bolster her case, goes over and finds Elaine Larson, the jet drag racing Elaine Larson,
2-time world champion,
and brings her over and says, "You're going to give me some driving pointers, right?"
Wow.
So that was a lot of fun. That was at the Higher Power Car Show, but this is going to be a lot of fun. So this is on the grounds of the American Muscle Car Museum. It is this Saturday. It's absolutely free outside, so the weather should be nice. Come on out. We are going to have actually all 4 of the Helping Seniors car raffle cars out there. So that means we're going to have a 2021 Chevrolet Camaro, a 2021 Dodge Challenger, 2021 Kia Sportage, and a 2021 Mazda Miata convertible. We're going to have all 4 cars out there, so you can come out and just kind of figure out which one you like best, and get your tickets so that you are set for the 2021 drawing. That date has already been set. That's October 9th, Saturday, October 9th at the American Muscle Car Museum. But it's free to come out on the outside. And then, like I said, Mark is opening up between 11 a.m. and 2 p.m. the interior of the museum. And he's requesting a $20 donation for charity to go inside and tour the museum. But even that is a fantastic opportunity. So you get 500 cars outside. I don't know. Do you remember, was it like 300 cars he's got?
At least 300.
Oh, yeah.
Oh, yeah. Yeah, so
I mean,
what?
it's really any car enthusiast, old vintage cars or all the way up to modern cars, but mostly a lot of older cars. If you're a car buff, you'll be in virtual car heaven.
Yes, and if Ed is around, grabbing
Yes.
Ed and having him explain a few things and talk to you about some of the cars, the history, his knowledge of those cars was amazing.
Yeah, they're actually still up on the Helping Seniors website. We were so fortunate. Last year, they invited us into the museum and gave us like a private tour with Ed. Ed, we're talking about Ed Diedick. He's the operations manager, or he's the guy, I guess, that keeps all those cars running for Mark. I mean, Mark could walk in and say, "Hey, I want to take a look at this car over here," and it'll crank right up. And that's thanks to Ed and his team, who just always keep everything in tip-top condition. And when he was walking us through the museum, it was fantastic. He could point to a car without having to pull out notes. He'd go, "Let me tell you," down to who owned it and all that kind of stuff.
Oh, the history behind all of those cars were amazing.
Yeah. So this is going to be this Saturday. So March 27th, put this on your calendar. It's a beautiful spring Saturday, March 27th. We're going to be on the grounds of the American Muscle Car Museum from 10 a.m. to 3 p.m. We're going to be out there with Facebook Live, everything. It's just going to be an amazing time out there. Hey, John Harper, are you going to be able to join us on Saturday? I hope so.
I hope I'll be able to get out there in the afternoon.
Yeah, it's a great drop by. You won't be disappointed. When I was talking to Walt, who is the gentleman who is organizing the whole event, he said, Kerry, 500 cars that they've got registered.
That's going to be incredible.
Biggest number. It's going to be amazing. So when we come back on the other side of the break, we're going to talk to Jennifer Helin, who has employment opportunities straight ahead for you. But you want to be sure you stay tuned to Helping Seniors Radio. We'll be right back.
90.3 FM. When you wish upon a star, Kerry Fink, you might win a new car, right?
Hey, I like that. I was going to say that sounds kind of optimistic and hopeful. So you got to get your Helping Seniors car raffle ticket. And so I'm Kerry Fink with Helping Seniors of Brevard on behalf of Joe Steckler, our president and founder, and also Kim Bernard, our education specialist. Thank you for being here for today's Helping Seniors radio show. And as John Harper was just telling you, absolutely, get your car raffle tickets. If you like to get stuff online, it's very easy to do. You just go to helpingseniors.carraffle.com. If you like to talk to nice people on the phone and have them help you get your tickets, you just give Kim Bernard a call at 321-473-7770, 321-473-7770. And if you want to meet really nice people in person and get your tickets, you go see Jennifer Helin and her fabulous team at Seniors Helping Seniors in Melbourne.
We do. We have tickets at the office. We're on the corner of Dairy and Hibiscus. We're 1103 West Hibiscus Boulevard, right across from Rockwell Collins, or Collins Aerospace now, as it's called.
Yeah.
Come on over to the office. We'll even give you a cup of coffee.
Yeah, and then you can really we're gonna spend some time talking with Jennifer, because there's some exciting things going on at Seniors Helping Seniors. In particular, it has to do with job opportunities and things like that. But I just want to say and then the fourth way that I want to remind you, because we spent a lot of time talking about it last segment, is come on out and see us at the American Muscle Car Museum on Saturday, because we're going to be right out front. They've said they've reserved, we'll call it the Helping Seniors reserved space right there by the front door leading into the museum, and we're going to actually have all 4 cars out there 10 a.m. to 3 p.m. This is this Saturday, March 27th. It's free of charge to come out. It's the Cape Canaveral Antique Auto Club having their big 500 plus car shows, and then Mark Pylock, the owner of the American Muscle Car Museum, is opening it up, so we can, even for a $20 donation, go inside and check out his, it's like $70-80 million worth of cars he's got in there.
Absolutely. It's amazing.
Unbelievable. So we also have in the studio today Dr. Kevin Kilday, who we were talking about with Holistic Health Center. And we spent some good time talking in the first part of the show about some things that are related to COVID and how we can take advantage of a holistic approach to get us through all of this. But I wanted to talk now because there's so many things that, you know, we got shut down for such a long time, and, you know, maybe people were working and decided that, well, I'm just going to stay home and take care. But now that things are kind of reopening and people are, you know, quite frankly, a little tired of just staying home, you have a tremendous opportunity for the right individuals over at Seniors Helping Seniors. Tell us a little bit about that.
We do. So what we're finding is, as we're starting to come out of COVID, a lot of families are ready to get out. They're ready to start doing things. I just had a gentleman call me yesterday, and he and his wife would really like to get out for a date night. They'd like to go out Friday afternoons and just play, but they would like someone to stay with mom while they're gone. So that's the type of thing that we do at Seniors Helping Seniors. As you know, sometimes we're helping the kids out, sometimes we're just directly in the senior's home, but we provide Hobaker companion services, transportation, light housekeeping, meal preparation, and we only hire seniors to do that, because what we find is that peer-to-peer connection really works. It's a lot more socialization.
Amen.
And it's you know, somebody that they feel really comfortable with having in the house. We don't try to recreate the wheel. If you've made your bed that way for 75 years, then that's the way we're going to make it.
No, that's good.
And so we are looking for seniors who would like a really fun part-time job that they feel really good about. And one of my caregivers emailed me a couple of weeks ago. She's a fairly new person with us, and she said she's getting just as much out of working as she feels like the clients are. She's really enjoying what she's doing, and she feels energized and renewed because of it.
I would think so. So I guess a question I want to ask, if somebody's listening is thinking like, so what do you define a senior as? I mean, in terms of somebody calling in.
So not that I think a senior is 50, because I'm over that now, but we go with AARP. They're big enough to make that rule.
Yeah.
So we go with 50 and over. So if someone is 50 and over, we would love to hear them. We're a great part-time job for a senior, because we understand they might want to go out and see grandkids, or, you know, take a little vacation. So we tend to be very flexible, and we try to keep people very local to their area. And we really have a lot of fun with it. We call it our Seniors Helping Seniors family, because we, you know, one of the policies in the very beginning is I didn't want to hire anyone that I wouldn't put in my mom's house.
Sure.
But in the same token, I'm not going to put one of my employees into a house that I wouldn't put my mom in.
Oh, that's
so we're
good. That's
pretty
good.
protective both ways. And because of that, it really works.
You know, and I remember meeting you and your mom years ago when you were first starting this. You guys have been in business for quite a while here in Brevard. But to be honest, this was something that you joined a service that's actually kind of like global, isn't it?
It is. So we've been here, it'll be 9 years in April. Officially, but Seniors Helping Seniors has been around for now 21, almost 22 years.
Wow.
And we are in Malaysia and in the UK. I've got a really nice relationship with the leads over in UK, and they've got probably 5 or 6 franchises now in England.
Wow.
So it's just a really great company that we fell in love with back in the day when we started, because we saw the need in our own family, and we realized there was a lot of wisdom in having a senior coming in and helping a senior. And if you've ever been on the side of the child, when the kid, and you're trying to take care of mom and dad, they don't like it very much. And you're the bossy child. But yet a senior can come in and tell them the exact same thing, and it's gospel. So it works. It takes a lot of pressure off of the families. The seniors have a comfortable fit. So we would, if anyone would like,
it's also
a
very
job,
good
yeah.
to have someone visit who's that person's alone.
Exactly.
Right. Because if you don't mind, I just want to tell you a little short story.
Sure.
You know,
Yeah,
it'll
this is
only-
Dr. Kevin Kilday with
it'll only be a
Holistic Health
minute.
Center.
This is something that I experienced just a week and a half or so ago. I ended up with a sinus infection, okay? And my right ear was very much in pain. And then I ended up with some antibiotics that just didn't agree with me. So I was getting a little concerned. All right. So for the safety of my my clients and my family, I went and I got tested for COVID. All right. Because my doctor says you don't have it. I just wanted to be safe.
Better safe, right?
But that feeling of and this is one of the reasons why I just submitted this article actually yesterday to the other magazine that I write for, the spiritual connection during the pandemic, because you're really you're alone. You're alone with your disease, okay, and possibly COVID, or it could be anything else, especially if it's life-threatening. That is a very, very lonely feeling. So what I'm trying to say is, if you have people, that go and visit, people who are alone. I mean, that's a great, that's a great type of business that you have.
Thank you.
It's,
Thank you.
Because I've been there, and that's what really influenced me to write this article, and also. When you start thinking about your own mortality, that's why it's called the spiritual connection, because, I was thinking, how to improve, even though I have a good relationship with my Lord and Savior, I was thinking of how to improve it.
Well, that's always a good thing to do.
Right. And I was questioning, is my relationship with Him where it should be?
Right.
So it really... It gets you a lot of, that's why it says in my article, you're alone with your thoughts, and then often you really lean more towards God.
Well, this is one of the things we've talked about a lot during this whole year. I remember having this conversation with you, Jennifer Helin, that, I guess a lot of times mom and dad is down here, but maybe is from up north originally, and so the kids are probably up north working, and so normally they would come down and be able to check on mom and dad, but during this whole time with travel restrictions and all sorts of complexities that COVID has introduced, people have not been able to, even the kids, have not been able to get down here and say, how's mom or dad? And you guys have really had to step in and sort of be those eyes, arms, and ears for the kids in many cases.
We have. In a lot of cases, we've increased visits so that we can have more socialization, because people were so isolated, and you could see the effects of that isolation.
Right.
They were not eating as well. They were not taking medications properly. They were just an overall kind of sense of, maybe not depression, but definitely malaise. And it really does affect your health. So increasing those visits and then being able to say, hey, this is how mom's doing today. This is what's going on. If we did get out for a drive, so she got to see the ocean, or we took a beautiful ride along the river, whatever happened that day, the kids can know about it and know that someone is there, someone's watching. It gives the family a lot of peace of mind to know that everything is okay and that they are getting a little bit more socialization, until the family can start to come back down and get together.
And I think that's the other advantage, when we're kind of like coming back to the topic about could this be a good job opportunity for somebody 50 plus? And part of the reason why this works is because there's a little bit more of a connection, because it's nothing against younger people or older people or anything like that, but demographically, right? We all grew up with the same kind of music and the same kind of, for better, for worse, and the world keeps changing. So, a 50 plus is probably less likely, maybe, this is a generalization, so I'm going to already get myself in trouble with this, but, a younger person is used to texting and everything, and smartphone works everything, and may not necessarily think that verbal communication skill is as important as it was to an older generation. And I think when you have a 50-plus person working with a senior, there's going to be more of a connection. Just unless that younger person is really that exceptional on communication skills.
Well, and we go beyond that as well. When we're out with a client, really talk about their background and what they've done for a living, what their hobbies and interests are, what kind of music they like. And then when we go back to the office, we try to match that person with someone that we have. And that works beautifully. We had a lady that was from Wisconsin. She was a big cheesehead. She was a fan. So we just happened to have another lady from Wisconsin, and she fit all of the particulars. But that was a big one. And they have a ball together. Yeah. Just that small piece that got them off on the right foot. And so we really do try to match personalities and interests so that it's even more of a better fit than just age.
That's probably also part of the art and skill of what you guys have not only are able to do, but have learned over the years to do, because that's probably one of the reasons why it becomes a very good fit employment-wise for people 50 plus, is because you do take the time to try to get the where the client is together with the caregiver and make sure that they're gonna fit well together.
Absolutely, and it's just as important. That fit is just as important for our employee or our caregiver, because when they're really happy with that fit, the client's really happy. Oh, so it works beautifully.
There's no question about it. So I was going, if you're a 50-year-old person, you say, listen, because I guess I'm asking because I don't know. Is this like you could work part-time or you could work full-time or whatever works, or how do you work with people on that?
Traditionally, we have always hired part-time because we understand most seniors just want to work part-time. Right now, if somebody wanted to, we could keep them pretty darn busy.
Okay.
But for the most part, most of our seniors want to work about 20 hours a week.
Okay.
And so we stick to that.
And what kind of skills would someone want to, like if they're sitting at home, they're hearing this and they're saying like, well, I don't know, I don't really have medical training or I mean, I guess it might be important to kind of describe for a listener, who do you look for? What are the things that somebody say, oh yeah, I could do that?
Well, we don't do any of the medical or any of the hands-on. So thankfully, they don't really need, to have a CNA or an HHA or that medical background. Our ideal person is usually someone who has taken care of a spouse. Mm-hmm. They've taken care of their own mom and dad. We've got a lot of people with various backgrounds. We've got a Wall Street exec. We've got teachers. We've got, professors who've worked at FIT. We've got an amazing group of people. But the common thread is typically that they really enjoy seniors and that they have taken care of family members. So they've been there, done that. They understand. They've got a lot of compassion for the senior and for their family of that process, that aging process that they're walking through. So they make wonderful caregivers.
No, it sounds like it would be an amazing opportunity, because I guess as you work with the right individual, there's opportunities to fit to the time that you have available, and it really could be a nice wraparound for something that somebody's doing maybe in their otherwise golden years. Maybe they have sat around the house a lot. I'd like to do something. It's like the best kind of work, right? It's work that you're going to get compensated for, but really the reward is in just doing something that's very helpful and very necessary.
Absolutely. And I will say, for the whole senior industry, on behalf of the whole senior industry, there really is a caregiver shortage. So if somebody does say that to you, that is true. There is a caregiver shortage right now. And CNAs, HHAs, nurses, the whole rung of that ladder, there is a shortage. So sometimes when people aren't getting to the bedside as quickly as we would like, I try to have a little bit of patience, because I know a lot of facilities right now are they're needing staff, and so we're kind of all in that same boat.
Yeah.
But thankfully, we're not fighting over the same demographic, I guess, because we are hiring seniors.
Yeah, and Joe Steckler, our president and founder, he's always talked about, he calls it elements of care. And he said one of the things, when you're making your aging plan is you want to get the right element of care in at the time that it's appropriate. You may need to step up a level as you go along, but we've always talked. I've heard you guys do so many radio shows and TV shows where you guys have really talked about you're really the right person for somebody who's just deciding, hey, it's time to get a little bit of help at home, and that's where you guys are able to fit that so nicely.
Absolutely, but we are seeing, because of COVID, as we come out of COVID, an increased need.
Yeah.
So we've been busier than ever, which is a great thing.
Right.
But we are definitely seeing, and that is, again, across the board in the senior industry. We are seeing an increased need. I think we've got a lot of people moving into the area from New York and California and other states. So as that population increases, and Brevard County is we tend demographically to be a little bit older. So we are definitely seeing the need in Brevard County for good quality care for seniors, and it's an increased need.
Well, one of the statistics we love to quote from the Helping Senior side, as you know, is we're in a county that 1 out of 4 people is over the age of 65. And then 1 out of 2 people, if you go back and use AARP, is over 50. So we definitely are in a county, and the way I like to phrase it is you are a senior, love and care for a senior, God willing, you're going to be a senior. So all of this is relevant for you. And so, Jennifer, if somebody is like hearing this and they're intrigued, you say, well, I just want to get some more information. I haven't really done this kind of work before, certainly not outside, but I helped Aunt Susie. I helped, Uncle Fred, or they have that background of just being a compassionate senior who wants to maybe try to take a look at some of this. How do they get in touch with you? What do you want them to do?
So give us a call at the office, and we can talk it over and let you know exactly what we do. And if it sounds good, then we'll have them fill out an application. But our phone number, again, is 321-722-2999.
Yeah, I'm going to have you give the phone number again because, again, I can think of 3 different reasons people are going to call your office. First is they might be intrigued about what we're talking and say, I'd like to get information. This could be the great part-time thing that I could really do that's meaningful and important and will pay. So it's a great job opportunity. Secondly, it may be a senior who says, I really would love to have that kind of help in my home, or somebody who's caring for seniors, so they might want to give you a call. And of course, the third and most self-serving reason is because they would want to maybe make an appointment, come by and pick up some Helping Seniors car raffle tickets. But in all cases, you need that phone number. So let's go with that again.
It's 321-722-2999.
Again, that's Jennifer Helin with Seniors Helping Seniors, a great company that takes really good care on that. You call it homemaker companion.
That's our licensing, yes.
And so that's a great place. And Jennifer is a wealth of information. She has sat on the board of directors for Helping Seniors and helped Joe with this almost since the day Joe got this whole organization rolling. Helping Seniors is now in its 10th year of service to the county.
Yes.
And people often ask us, I said, what do you guys do? And I said, well, number one, for 10 years now, we've operated the Helping Seniors Senior Information Helpline, which is a free call here in Brevard County, 321-473-7770, 321-473-7770. And we have helped more cases than you could shake a stick at. It's like 3,500 plus by now. And what it is, people say, well, is it like a referral? I call up and get a phone number. Sometimes it could be that easy. Most of the time, in the vast majority of the time, it's not. So what Kim, our education specialist, does is sits down and works with somebody, absolutely, and the family, free of charge, to try to find a resource that's going to meet the need. And we get calls about everything: housing, transportation, legal, medical, financial. You would be amazed at the different kind of calls that we get. And I am always surprised, Jennifer, how often Kim is able to make a difference.
Absolutely. And I see the need every day for that senior helpline. I love that Helping Seniors does that for our folks here in Brevard County, because you don't know what you don't know.
That's right.
I need, as a senior, I need a resource for this. I need help with my eyes. I need help with hearing. Where do I go? I've been diagnosed with macular degeneration and I can't see anymore. And if you call Kim, she will set you up with the Brevard Association for the Blind, for the Center for the Visually Impaired. She knows exactly what resources are out there for you. You will get you hooked up with them. And typically she'll call back and make sure you really did get what you needed and your problem was solved. So it's a great resource for so many different topics because there are so many things seniors need. We get the calls almost on a daily basis in our office.
Right.
And if we can help, we do, but a lot of times we will send them on to Kim.
Yeah, I was going to say Kim gets referred calls from a lot of different places. It is amazing, and I've always told Joe Steckler, our president and founder, to me it's like the little engine that could. It's a small organization. We can't do what we do without your help. But I am really surprised how often we're able to make a serious difference, a really helpful difference in people's lives. And that's why the work of helping seniors is really so important. So one of the things in the last couple of minutes we have on the show, we want to switch back to another fun topic, but it really hits on all the things that we've talked about along the way. We've talked about the challenge with isolation. In fact, a couple of years ago, we did a survey to find out what Brevard County seniors would self-report as the most important aspects of their lives that they need help with. And of course, you would think medical would be up there, housing would be up there, transportation would be up there. But one of the things that was really probably maybe to us, but probably not to you, Dr. Kevin Kilday, and you, Jennifer Helin, was this sense of I need more socialization. I need more ways to interact. How do I meet people? Maybe I'm from up north and my base of friends is still up there and I'm new to the area. How do I get involved in the community? And so one of the things Joe years ago said, Gary, we should have a Helping Seniors Travel Club where people, from this area could get together, do things. So on October 17th, kind of as an answer to that, we're going sailing. We're going sailing on the MSC Divina 7 nights out of Port Canaveral. It actually ends up being a fundraiser for Helping Seniors because MSC Cruises is going to donate proceeds back from that sailing to help us in the work of helping seniors. But it's also a great opportunity because, number one, it's local. So it's sailing right here out of Port Canaveral. So you don't have to hop on a jet plane, fly halfway around the world to get to the cruise ship. You just pop over to the port and Port Canaveral and roll onto the ship and have a great cruise with us and a lot of other people from Brevard County. And so, as you guys know, if you've cruised before, I know you guys have, but you make good friends on the ship, but then you're calling them because they're out on the West Coast or something, and you don't really get to stay in contact until another cruise. But here you make a friend on the cruise ship and say, well, we can have lunch next Tuesday when we get back. It's a whole different thing.
Yeah, I'm a cruiser, and it's a lot of fun. It really is.
So you have to go to helpingseniourstravelclub.com to get information. The date is October 17th. We're gonna be talking a little bit more about that as we go along. Or you give Kim Bernard a call at the office, and she'll get you connected. Again, 321-473-7770. So we are out of time, but Dr. Kevin Kilday, one quick time for Holistic Health Center, your phone number and website.
Yes, the website's Holistic. It's HOLISTIC, healthcenter.us, and the phone number is 321-549-0711. And if you're looking for the best job that you could ever have as a senior, or just get some great help as a senior, you give Jennifer Helin a call at Seniors Helping Seniors. And let's go with the phone number a couple of times.
That is 321-722-2999, and it's seniorshelpingseniors.com/Brevard.
Great. Well, thank you, guys, and we'll see you next week for Helping Seniors Radio. On behalf of Joe Steckler, and our whole team, hope you have a great week ahead.